At Newark Beth Israel, we are making every effort to create comprehensive care for our elderly population. Newark has a growing elderly population, and we want to make sure that they are treated with the grace and dignity that they deserve. Therefore, we have several components of geriatric care here at the Beth. We have a geriatric emergency department, which is sensitive to the needs of the elderly patient.
We have a geriatric department within our emergency department here at Newark Beth Israel. So when a patient arrives in our ED, it's really wonderful that now they're greeted by a nurse. So one of the first people they see when they come through our doors is who we call a greeter nurse, who can immediately triage that patient's complaint to the right area. So if that patient happens to be elderly, they'll be taken to our geriatric emergency department, which is an 8-bed isolated unit within the ED that really caters to the specific needs of a geriatric population. Number one, the providers in that area understand that geriatric patients have different needs, such that too much noise, too much light, too much distraction can be very unsettling to our seniors. So we try to keep that area a bit quieter, a bit more calm. It also has accessible bathrooms and other physical plant attributes that make it more senior friendly.
We have a brand new state-of-the-art geriatric unit.
We have private rooms in both units, and each room is large and they have a single bathroom with a sliding door, as well as each toilet does have a handle for our geriatric population to be able to assist themselves to the toilet. We do have side rails all along the hallways. We want to keep our patients mobile, so it does allow them to come into the hallways and still have an assistive device. We also have very bright wall colors in the hallway to kind of keep them alert to where they are, as well as big lettering on the boards in their rooms, as well as the signage in the hallway. They feel like the unit is very welcoming and it is very homely to them. So we're able to kind of accommodate, yes, you're in the hospital, but we're still going to be able to assist you with having some sense of comfort.
We also now have the James and Sharon Maida Geriatric Institute, which is a comprehensive outpatient center where all the seniors' needs can be met in one place.
They will physically be seen in the James and Sharon Maida Institute, but literally right across the street is the Newark Beth Israel Medical Center. Across the street is the emergency department in case, God forbid, somebody needs a more urgent attention once they come to the institute. And alternatively, many geriatric patients that will be seen in the institute will need consultations with other specialties. Well, a lot of those other specialties are literally across Lyons Avenue, across the street.
I had 2 strokes within 5 years, which is scary. What I appreciated so much was that my records were here in geriatrics. My doctor, Dr. Uma, was able to direct whoever needed the information on me to help me while I was here, and that was very comforting. Everything was right there. Had I been in a strange hospital with no geriatrics, I don't think I would have recovered as fast as I did.
When a patient comes here, they're going to be able to work directly with the doctors, the nurses, the staff. Very personal relationship that we will give them when they come here. We're available 24/7, very easy to contact us and they'll find out, which is very important in geriatrics. We have extra services here. We offer volunteers, physical therapy, identifying fall problems, driving problems. These are much more unique to these patients as they get older.
The Home Friends program here at Newark Beth Israel Medical Center and Children's Hospital, New Jersey is a chore companionship type of service. Home Friends go out to our elderly community to help them with their daily chores and household daily living needs. We also have programs here at the hospital that look at food and nutrition. So there's a nutrition program that our elderly are able to participate on a regular basis to make sure that they're buying the right foods, they know how to cook the right foods, as well as transportation back and forth to our facilities.
The senior population at Newark Beth Israel is very important to me, both personally and professionally. They are our elders, and they deserve respect and dignity as they age, to make sure that they have all of their needs met, not just the physical needs, but psychological needs, spiritual needs. And we want to do as much of that as we possibly can at Newark Beth Israel because our seniors deserve it.
I'm very fortunate to have great doctors And I could go down the list of doctors that I have met at Beth Israel who actually had empathy for me, who took care of me, and who made sure that I was all right before they discharged me. So I'm very grateful to be a patient here.
I think this is a special place. And the reason why I say that is because the care is so personal and so attentive.
We're able to bring healthcare as well as personal touch, which I feel makes me feel and my staff as well feel fulfilled. And I'm sure it makes our patients feel the same way.
Geriatric doctors are very rare, I know, and I'm just so blessed and so thankful that I'm here at Newark Beth Israel with the best of them.
Geriatric patients are special, and what they want most from this job is that you hold their hands and listen to them. That's what we do.